Let me ask you something. When was the last time your doctor sat down with you? Not for 3 minutes to renew your prescription, not with one hand on the door handle, but actually sat down, looked you in the eye, and said, "Here's what I'm genuinely worried about for you." For most of you watching this, that conversation has never happened. Not because your doctor doesn't care, they do, but the average doctor's appointment for a senior today lasts 11 minutes. 11 minutes to review your medications, check your vitals, update your chart, answer your questions, and get to the next patient. In 11 minutes, there is no time for the warnings that don't have a prescription attached to them. I'm Dr. Daniel Hayes, and today I want to give you the 5 things I wish every doctor had time to sit down and tell their patients over 60. Not the standard advice you've already heard, not eat less salt or walk more. These are the 5 warnings that sit quietly in the research, backed by real clinical studies that most seniors are never told. Some of them are happening to you right now, and you're probably calling it just getting older. You're not going to hear these in an 11-minute appointment, but you're going to hear them today. And one more thing before we start. I'm a doctor, but I'm not your doctor. Everything in this video is to help you have a better, more informed conversation with the doctor who knows your history. Use this as your starting point, not your final answer. Let's begin. Before warning number 1, tell me something in the comments. What's the one symptom you've been quietly dismissing as just aging for the past year or two? One word is enough. Write it down. You might be surprised what you find by the end of this video. Warning number 1. Your medications are talking to each other, and nobody is listening. I want you to picture a woman named Margaret. She's 72, lives in a small house outside of Columbus, Ohio. Sharp as a tack, does the crossword every morning, calls her grandchildren every Sunday. She raised 3 kids, worked as a school librarian for 28 years. Words were her whole world. Then, about 2 years ago, something started shifting. She would read a sentence and have to read it 3 more times before it stuck. She started losing words mid-conversation, reaching for a name, a phrase, and finding nothing there. She told her daughter she felt like she was thinking through fog. Her doctor ran tests. Memory screening came back borderline. He told her it might be early cognitive decline. The family started researching care facilities. Her daughter started sleeping with her phone on the nightstand, worried about a call in the night. What nobody asked was this: how many medications is Margaret taking? The answer was 7. Her doctor prescribed 2. Her cardiologist added 1. Her rheumatologist added another. She picked up 2 over-the-counter sleep aids on her own because she hadn't been sleeping well. And she took a daily antihistamine because of her allergies. 7 medications. And nobody, not one of her 3 doctors, had looked at all 7 together at the same time. Here is what the research shows. A study published in the Journal of the American Geriatrics Society found that nearly 40% of adults over 65 are taking 5 or more prescription medications at the same time. When you add in over-the-counter drugs and supplements, that number goes even higher. And the risk of a harmful interaction, one drug quietly working against another, increases dramatically with every additional medication added. But here's the part that was destroying Margaret. A class of medications called anticholinergics, which includes certain sleep aids, antihistamines, some bladder medications, even some antidepressants and antacids, has been shown in research to directly reduce a chemical in the brain that is essential for memory and clear thinking. One study from Indiana University tracked nearly 3,500 older adults and found that those taking anticholinergic drugs had significantly higher rates of cognitive decline and dementia. Margaret's 2 over-the-counter sleep aids both belonged to this class. She was taking them every night, and they were slowly turning down the volume on her own mind. The fog was not aging. The fog was in her medicine cabinet. 3 weeks after her daughter brought all 7 medication bottles to a pharmacist and asked for a complete medication review, something called a brown bag review, 2 of the drugs were flagged. Margaret's doctor adjusted the plan. The sleep aids were replaced. 4 months later, her daughter told me she was doing the crossword again, without needing to reread the clues. Here is what I want you to do this week. Go to every room in your home and gather every single thing you take. Prescriptions, vitamins, over-the-counter pain relievers, sleep aids, allergy pills, antacids, everything. Put them all in a bag. Call your pharmacist, not your doctor's office, your pharmacist, and ask for a complete medication review. Tell them you want to know if anything you're taking could affect memory or thinking. Pharmacists are trained specifically for this. It costs nothing, and it may be the most important bag you ever carry. Warning number 2, your sleep is not just rest, it's when your brain washes itself. And after 65, it may have stopped. Most people think poor sleep is an inconvenience. You feel tired, you drink an extra cup of coffee, you get through the day. What almost nobody tells you is that your brain has a physical cleaning system, a system that only runs while you sleep. And if that system stops working properly, the waste it was supposed to clear starts to pile up inside your brain. This is not a metaphor. This is anatomy. Researchers at the University of Rochester discovered that during deep sleep, the brain's support cells, the ones that hold everything together, actually shrink slightly. This shrinking opens up tiny channels around the brain's blood vessels. Fluid then rushes through these channels like a slow river, flushing out the waste products that accumulate during a day of thinking and living. One of the main things it flushes out is a protein called beta amyloid. You may have heard of it. It's the same protein found in high concentrations in the brains of people with Alzheimer's disease. In plain terms, your brain literally cleans out Alzheimer's-related waste every night, but only during deep sleep, and only if the cleaning system is working. Here's the problem. After 60, deep sleep, the specific stage of sleep when this cleaning cycle runs, naturally decreases. Research from UC Berkeley found that older adults get significantly less deep sleep than younger adults. And when that deep sleep drops, the nightly flush becomes less effective. The waste lingers. It accumulates. Over years, it builds. But here's what is rarely discussed. For many seniors, the drop in deep sleep isn't just normal aging. It's being accelerated by 3 specific things that are entirely fixable. Number 1. Sleeping with the television on. The light from a screen, even at low volume, signals to the part of your brain that controls sleep cycles that it's still daytime. The cleaning cycle gets interrupted before it can run its full course. Number 2. Alcohol before bed. A glass of wine in the evening feels relaxing, and for the first hour or two, it is. But alcohol breaks apart deep sleep in the second half of the night. You may stay asleep, but you're not getting the restorative stages. The cleaning cycle doesn't happen. A study published in the journal Alcoholism, Clinical and Experimental Research, confirmed that even moderate alcohol consumption significantly reduces the quality of deep sleep. Number 3. Undiagnosed sleep apnea. This is the most important one. Sleep apnea, where breathing repeatedly stops during sleep, is extraordinarily common in seniors and is massively underdiagnosed. Research estimates that over 40% of adults over 65 have some degree of sleep-disordered breathing. Most of them have never been told. Every time breathing stops, the cleaning cycle gets interrupted. And if it's happening 30 times an hour, the brain never reaches the depth it needs to run the flush at all. The warning signs of sleep apnea that seniors often dismiss: waking up with a headache, feeling exhausted after a full night of sleep, needing to nap heavily during the day, a partner who mentions you're snoring or says you sometimes hold your breath. If any of those sound familiar, write down this question to ask your doctor at your next appointment. Should I be tested for sleep apnea? One more thing I want you to take seriously. The research on sleep and brain health is not saying that poor sleep gives you Alzheimer's. It's saying that protecting your deep sleep gives your brain its best possible chance to protect itself. That's a different statement, and it's an important one. Tonight, turn the television off before you lie down. Skip the wine. And if you've been waking up feeling like you never actually slept, call your doctor and ask about a sleep study. It's one of the most underutilized tests in senior medicine, and it's painless. Warning number 3. Your blood sugar can be destroying your body for years before any test catches it. I want you to think about someone you know. Maybe it's you. Healthy enough by every measure your doctor checks. Annual blood work comes back normal. A1C, the number that measures average blood sugar, sits just below the flag zone. Doctor says nothing to worry about. But here is what the research has revealed about that zone just below the flag. A condition called prediabetes, where blood sugar is elevated but not quite high enough to be called diabetes, affects an estimated 96 million American adults. Almost 80% of them don't know they have it. And at the rates of routine testing most seniors receive, many of them won't know until the damage is already done. This matters for seniors in a specific and urgent way. When blood sugar stays even slightly elevated over time, not diabetic levels, just slightly above ideal, it does something very quiet to the small blood vessels throughout your body. It stiffens them. It makes the inner walls rough and sticky where they should be smooth. And blood vessels feed everything: your eyes, your kidneys, the nerves in your feet, and, critically, the tiny vessels deep inside your brain. A study in the journal Diabetologia followed thousands of adults over several years and found that people with prediabetes had measurably smaller brain volumes and worse scores on memory and thinking tests, even before any diabetes diagnosis was ever made. The blood sugar was quietly reshaping their brains while their blood work looked normal. Here's what makes this especially important for people over 60. The early physical signs of elevated blood sugar are so easy to dismiss as aging that most seniors never connect the dots. Do you feel thirsty more often than you used to? Dismissed as getting older. Do you feel a wave of heaviness and fatigue about an hour after a meal, especially a meal with bread, rice, pasta, or something sweet? Dismissed as just tired. Do your feet tingle or feel slightly numb, especially at night? Dismissed as poor circulation. Do cuts or small skin injuries take longer to heal than they used to? Dismissed as skin just doesn't bounce back the way it did. Every single one of those is a potential signal that blood sugar has been running higher than your last blood test showed. And the reason the blood test can miss it is that the standard fasting blood sugar test only measures what your blood sugar looks like after you haven't eaten for several hours. What it doesn't measure is what happens to your blood sugar 2 hours after you eat a normal meal. That 2-hour number, called a postprandial blood sugar, can be elevated in people whose fasting number looks perfectly fine. Here is what I want you to ask your doctor. Can we test my blood sugar 2 hours after I eat, not just fasting? I want to make sure we're not missing anything in between. That one question could give you, and your doctor, a much more complete picture. The power here is not in scaring you. It's in catching something early enough that a very simple change in what you eat at breakfast and lunch can reverse the entire trajectory. Research published in the New England Journal of Medicine confirmed that prediabetes can be reversed in the majority of cases through lifestyle changes alone, no medication required. But only if it's caught while there's still time to act. Warning number 4. Your bones are losing density right now, quietly, with no pain, and by the time you feel it, it will be too late. I want to talk about a fall. Not a dramatic fall, not a fall down the stairs, a simple, ordinary fall. The kind that happens when you reach for something on a shelf and your foot slips on the kitchen floor. Or you step off a curb slightly off balance. Or you stand up from a chair too quickly and feel momentarily dizzy. For someone in their 30s, this is a stumble, a bruise maybe, an embarrassing moment. For a senior with undetected bone loss, the same stumble can mean a broken hip. And a broken hip after 70, research is very clear on this, carries a mortality risk of 20 to 30% within the first year. Not from the fall itself, from the surgery, the bed rest, the infection risk, the loss of independence, and the physical and emotional shock of a body that suddenly can no longer do what it was told. 1 in 3 women over 50 will suffer an osteoporosis-related fracture in their lifetime. For men, it's 1 in 5. Most of them had no idea their bones were this fragile because there was no pain warning. Bone loss is invisible. It is completely silent. You cannot feel it happening. And here is the specific piece that most seniors are never told. The bone loss that leads to osteoporosis accelerates dramatically in a 10-year window. For women, the decade following menopause, and for men, the years roughly between 65 and 75. If there is no bone density test ordered during that window, the opportunity to catch and slow the process is often missed. A study in the Journal of Bone and Mineral Research found that a significant proportion of seniors who suffered osteoporotic fractures had never been given a bone density scan, despite meeting every clinical guideline that recommended one. But there's another layer to this warning that goes beyond the scan. Vitamin D and calcium are the most commonly recommended nutrients for bone health. But research has shown that the relationship between them is more nuanced than most people are told. You can take all the calcium your doctor recommends, but if your vitamin D level is low, the calcium cannot be properly absorbed. It essentially goes in and passes through without doing its job. A large study published in the American Journal of Clinical Nutrition found that vitamin D deficiency is present in an estimated 50 to 70% of older adults. Not because seniors aren't trying, but because the skin's ability to produce vitamin D from sunlight decreases significantly with age, and most people over 60 are simply not spending enough time outdoors, or when they are, they're covered up against the cold. Here is what to ask your doctor. 2 specific tests. First, can we schedule a DEXA scan to check my bone density? That's the standard, painless scan that measures exactly how much bone density you have. Second, can we check my vitamin D level? I want to make sure my bones are actually absorbing what I'm taking. Those 2 questions take 30 seconds in an appointment. The answer to them can change whether you walk into your 80s independently or whether a kitchen floor decides that for you. One more thing. Falls don't come from nowhere. The research consistently shows that muscle strength, particularly in the legs and hips, is one of the strongest protective factors against falls for seniors. And muscle loss accelerates after 60, just like bone loss, quietly, with no pain and no alarm. Simple chair exercises done consistently, standing from a chair without using your hands, gentle heel raises while holding the counter, have been shown in clinical trials to meaningfully reduce fall risk in seniors over 65. You don't need a gym, you need a chair and 5 minutes. Warning number 5. Loneliness is not a feeling, it's a medical condition. And it's killing more seniors than obesity. This is the warning I've wrestled with the most about including in this video, because it is the one that sounds the least medical. And that is exactly why doctors don't mention it. In an 11-minute appointment, a doctor can justify the time to review your blood pressure, adjust your statin, and check your A1C. They cannot easily justify the time to ask, how often do you feel lonely? When did you last have a real conversation with someone who isn't a doctor or a cashier? But I want you to hear this clearly. And I want you to hear it as a medical fact, not a sentiment. In 2023, the U.S. Surgeon General issued an official advisory declaring loneliness and social isolation a public health crisis in America. Not a social issue, not a wellness concern, a public health crisis. The advisory cited research showing that the physical health effects of prolonged loneliness are equivalent to smoking 15 cigarettes a day. 15 cigarettes. We would never tolerate a senior smoking 15 cigarettes a day and call it a personal choice. But we allow millions of seniors to live in near-complete social isolation, and we call it just how it is after retirement. Here's what the research shows is happening inside the body. When a person is chronically lonely, not just occasionally alone, but genuinely feeling disconnected from other people over months and years, the body's stress system never fully powers down. It stays at a low-level alert, as though a threat is always nearby. This constant low-level stress keeps the body producing higher levels of a stress hormone called cortisol. Over time, elevated cortisol does several very specific things. It weakens the immune system, making infections harder to fight off. It raises blood pressure, particularly at night. It disrupts sleep, and you now know what disrupted sleep does to the brain. It drives inflammation throughout the body. And it increases the risk of heart disease at a rate that researchers at Brigham Young University describe as comparable to smoking and obesity as a risk factor. A major research review published in the journal Perspectives on Psychological Science analyzed data from 148 different studies involving over 300,000 people and found that strong social connection increased the likelihood of survival by 50%. Not quality of life, survival. And the senior population is uniquely vulnerable for reasons that are completely understandable. Retirement removes the daily social contact that work provided. Children move away, friends pass away, a spouse may pass away, mobility decreases, driving stops, and the world quietly shrinks. What is so painful about this warning is that it often comes dressed as something else. Seniors experiencing the health effects of chronic loneliness often report more physical complaints, more fatigue, more pain sensitivity, more visits to the doctor for symptoms that don't resolve cleanly. They're treated for the symptoms, but the root cause, isolation, is never addressed. I treated a man I'll call Robert, 74 years old. He had been to the emergency room 3 times in 18 months for chest tightness that consistently cleared up after a few hours. Every workup came back negative. His heart was structurally sound. His arteries were in remarkable shape for his age. In the 4th appointment, I asked a different set of questions. Not about his heart, about his week. It turned out Robert had lost his wife 2 years earlier. His daughter lived 4 states away. He had coffee every morning alone. He watched television every evening alone. The last time someone had sat with him in his home was 4 months before that conversation. His chest tightness was the language his body had chosen to tell him something was wrong. And technically, nothing was wrong with his heart. Everything was wrong with his life. I referred Robert to a senior community group that met twice a week at his local library. Within 6 months, his emergency room visits had stopped. Here is the medical action I want you to take from this warning. First, be honest with yourself. On a normal week, how many real conversations do you have? Not transactions, not thank you at the pharmacy or small talk with a neighbor. Real conversations where someone asks how you're doing and waits for the answer. If the number is very small, that is a medical concern, not a personal failing. Second, if you have a senior in your life, a parent, a neighbor, a friend, call them this week. Not to check a box. Call them and ask about something that matters to them. Let them talk. That phone call may be doing more for their health than their statin. Third, ask your doctor this. Are there community programs or social resources you'd recommend for someone at my stage of life? Many doctors don't volunteer this information, but most will engage with it when you ask directly. Research from Harvard's Study of Adult Development, one of the longest-running studies of human happiness ever conducted, tracking people for over 80 years, arrived at a conclusion that stunned some in the medical community when it was published. The single strongest predictor of health and longevity in later life was not diet, not exercise, not genetics. It was the quality of a person's relationships. This is not soft science. This is 8 decades of data, and it belongs in every doctor's appointment. Let's put all 5 warnings together, not to overwhelm you, to give you a clear, simple action for each one. Warning 1. Gather everything you take into a bag. Every prescription, every vitamin, every over-the-counter pill, and ask your pharmacist for a complete medication review. Ask specifically about anything that could affect memory or thinking. Warning 2. If you wake up exhausted after a full night of sleep, if you have morning headaches you can't explain, if someone has mentioned your breathing or snoring at night, ask your doctor for a sleep study. And tonight, turn the television off before you close your eyes. Warning 3. At your next blood test, ask specifically for a postprandial blood sugar test. Blood sugar measured 2 hours after a meal, not just a fasting number. Ask if your A1C picture is complete. Warning 4. Ask your doctor for a DEXA bone density scan and a vitamin D blood level check. 2 painless tests that can tell you whether your bones need attention before a fall decides for you. Warning 5. Be honest with yourself about your level of connection. If your weeks are quiet and you're carrying that weight alone, bring it up with your doctor. It belongs in the conversation as much as your blood pressure does. You came here today for 5 warnings your doctor is too busy to tell you. What I hope you're leaving with is something different. The understanding that an 11-minute appointment is not the ceiling on your healthcare. You can walk in with a question prepared. You can say, I watched something that made me want to ask you about this. You can bring a list, a notebook, a bag of pill bottles. Your doctor has the training. You have the time they don't. Together, that's a very powerful combination. I'm Dr. Daniel Hayes. Leave a comment below and tell me, which of these 5 warnings surprised you the most? And if one of them sounds like something you've been feeling but have been calling just aging, tell me that too. Hit the like button. It tells the algorithm this conversation matters, and it puts this in front of the next senior sitting alone at home, dismissing something as just getting older that deserves a real answer. Share this with one person, the one who takes a handful of pills every morning, the one whose spouse mentioned the snoring, the one who's been quieter lately and more tired. They deserve to know what you know now.